IMA seems to be very excited about this. In fact, these are IMA's recommendations alone. How do you explain this? Even with a 0 percentile or a -40 score, one is meeting the eligibility criteria.
Good evening, everybody. IMA, in fact, had written to the Health Ministry almost 1 year back that there should be some consideration in lowering the percentile. We never said it should be brought down to 0.
Okay.
Because there was a vacancy of almost 18,000 seats, and there was a need for specialist doctors around the country, IMA gave a suggestion that lowering the percentile can improve. But we never said we should compromise on the quality of the doctor.
So are you then favoring or are you upset with what's happened?
No, we are upset in sense because the way it has been brought down to such a level, we are upset about that.
And have you moved the government about this?
No, now that it has come only today. Okay. Now this needs a debate.
Okay, Dr. Rohan Krishnan, you have been very vocal about this as well. You've heard Dr. Dilip Banushali saying that, listen, lowering percentiles is a good idea. You are saying lowering percentiles is happening almost every year and compromises the entire system and its credibility. The fact that it is brought down to 0, for you to respond first.
Being brought down to 0 is the mockery of the whole medical education system of the country. And medical system is now very global. So we see what is happening in United Kingdom and their medical councils, and what the Australian Medical Council or Singapore Medical Council per se are doing. And if you see any of the examination pattern in the world, any of such examination for postgraduate degree or for practicing medicine, this is not going to be MBBS doctors. These will be the specialists of the country whom we are talking about. They will be treating your children as pediatrician or curing cancers as oncologist. The major question which lies here is that, are we looking for degree holders, or we are looking for someone who can actually do the treatment? Now, what happens in such cases that when right now you very aptly compare two students, two scenario, that one who has gotten a higher marks and another who has gotten very low marks, -40 marks, and both are now eligible for counseling. But the more sad part is that the one who has gotten very low marks, -40 marks, will be able to afford a seat in a private medical colleges, which charges around 2 to 3 crores of rupees for one seat. And they are having such 50 and 60 numbers of seats. Now, one point that I want to raise is that why these seats were not filled earlier. These are only because of two things. Firstly, the exorbitant fees. And secondly, that these institutions lack merit. They don't have teachers, they don't have facilities. So a doctor who wants to learn, who wants to grow, who just does not want a degree, are not going to choose such seats. So I can barely tolerate reducing cutoff marks for like if the cutoff is 396 and you reduce it another 20-30 points, so that if someone who has got 395 or 370, those people have gotten another chance that they can.
So you're talking about 25 to 30. We're talking about points being dropped to 300, 400, 500. Dr. Banushali, do you want to very quickly respond to what Dr. Rohan is saying? He's basically even against lowering the bar year on year after this. You are saying dropping the percentile is a good idea. He's saying dropping the percentile is essentially to fill the pockets of private institutions that don't even give you the merit that's required. Very quickly.
The idea behind asking for reducing was to fill up the 18,000 which were going vacant. As such, we need so much of specialized doctors throughout the country. So lowering, we never said the percentile, what percentile should be brought. It should have been discussed with us. We just said that it should be brought down. Now, this is very drastic reduction in the percentile.
No, but say even to drop the percentile, the point is, why drop the percentile? Raise the bar. These are doctors of the future. These are doctors who are going to be treating you, me, my families. You know, ordinary citizens of this country in government hospitals and outside. Why drop the bar?
Well, see, number one was there was vacancies in the postgraduate seats. Nobody was taking it. Second thing is, see, even if they get a seat, say after lowering the percentage, they get the seat, they have to appear for exams. for MD, MS, this thing. They are just not getting post-graduation seat without appearing for exam. And if they are good, they'll pass.
We are discussing the NEET row. We are asking, is this score over seats or seats over score? Manish Bariyar, very quickly over to you. On my panel, I'm being joined by Dr. Pooja Tripathi, Dr. Dilip Bhanushali, as well as Dr. Rohan Krishnan. Thank you very much. Manish Bariyar, how do you explain this?
Yeah, good evening to you and my co-panelists and all the viewers. This is a very tough discussion both ways, but I feel that, 18,000 seats are lying vacant in a country like India where every seat is 1.5 crores. It's a huge, colossal wastage of public money. So I don't think this is about, a country cannot afford so many shortages of doctors. So it's, empty hospitals and empty classrooms. I was also listening to the doctor very intently, Dr. Rohan. It's not about private medical colleges. I'm sure you would know more than me that almost 65 to 70% of vacant PG medical seats are in newer government hospitals or they are in rural areas. And their fees is around 10 to 15,000. I think, I don't know about him, so probably he's looking at from a very city-centric point of view. What one understands is that there are a lot of specialists like radiologists and pediatricians and as well as psychiatrists. These are not available to rural areas very easily. In fact, there's a huge shortage of these kind of medical professionals. And as Dr. Bhanushali said, that all of them are going to go to medical colleges and they have to have, passed the exam. So sometimes there is a lot of intellectual elitism in these kind of things. Is there a guarantee that, and that's just for the sake of discussion, that there is a guarantee that somebody who has a 90 percentile is turn out to be a better doctor than somebody who has got a 40 percentile? I don't think data suggests that so exclusively that a person having higher percentages would be a better doctor. So I think one has to look at holistically the need of this country. But one thing I must assure that the government has done a lot to ensure that things fall in place. There is now, you have an NMC now, instead of MCI, their guidelines are there, very strict guidelines. I've heard that number of seats have been scrapped or people are not allowed to pass. So I think a better system is a good exit system where, the exams are done properly, people come out in a better fashion than the entry.
Okay.
Because,
Manish Bariyar, one thing that comes out of what you are saying is the instant reaction is whenever we talk about reducing the bar, it's often made into urban versus rural. That is uncomfortable. It's uncomfortable. Dr. Pooja Tripathi, very quickly, you are a doctor. Do you want to respond to what Manish Bariyar has said?
First of all, I want to understand which rural areas have medical colleges from Manish. And Sneha, first of all, let me introduce, say that it's good to see you after Mirror now on News9. And welcome to News9. And Sneha, the cost of a bad policy in medical education is not loss of revenue or some anti-academic. It's a loss of someone's life. Here we are discussing, access should be expanded. We all agree on that. But what is at the cost of this access to be expanded? The continuous, argument I'm hearing is this loss of the seats are lying vacant, seats are lying vacant. The fundamental questions is why are seats lying vacant? Seats are lying vacant because there's been indiscriminate expansion of private medical colleges without any quality and that exorbitant fees to Rohan Krishnan was right. And that's why, that's why these seats are lying vacant. And when you do things like this, minus 40 or reduce the percentile to 5 points, the structural collapse of merit, competence and minimum standard. These are the doctors that will go out in the, outside world and treat patients and will treating specialities. These are PG seats. And when you remove that barrier, when you remove that barrier of a minimum competence, minimum knowledge, all it is reduced. This whole process is meaningless. All it is registration exercise. And it's not about the welfare of public health. It's not about the welfare of patients, or it's not about welfare of medical education in India. It's only about welfare of the deep pockets of the...
I'm told I'm left with just 2 minutes. So I'm going to give 15 seconds to Manish Bariyar and then 10 seconds to Pooja Tripathi to do a quick counter before I come to our doctors, our experts. Manish Bariyar, very quickly, 15 seconds.
Pooja ji is blaming the increasing the number of seats, and India faces shortage of doctors. I don't know, like 2014, there were only 51,000 seats, and now you have 1,05,000, and it is said that every year India needs 1.5 to 2 lakh doctors every year, and we still have only 1.05 lakh MBBS seats. The number of PG seats in last 10 years have gone up by 80%. I would question what the government had done up till now,
Okay.
till 2014.